Hi friends, welcome to the NS Pharma. Today we are going to see the latest Viva questions for Oman Pharmacist License exam. We know that after passing online Oman Prometric exam, we have to attend an oral Viva for getting the license. Before going to the video, please like and subscribe my channel, and also don't forget to press the bell button. So let's begin. In Viva panel, there will be almost 6 members generally. They will ask some questions and they will tell you to pick one of the prescription, and the remaining questions will be based on that prescription. So no need to become panic. Sit with full of positive energy. Try to tell the correct answer to the questions. No need to become more descriptive. Just look at these all things, you will be pass. So here I will give you Viva questions asked to one candidate who appeared for Viva on July month of 2019. Okay guys, so the first question was, introduce yourselves. Whenever you enter the room for the Viva, you just greet them. Tell them good morning, or in Arabic, Assalamu alaikum, whatever. Start with that one and sit in the seat. After that, they will ask you a question. If they ask you introduction, just tell the name of your name or and country of origin, from where you are coming, and your educational qualifications, your family members, or if you know any Arabic terms, just tell all these things. You know some Arabic terms. If you know some Arabic terms, that will be little bit more positive. That means there's a chance for more passing, like that. It's not necessary to learn Arabic terms, but anyway you have to learn afterwards. The second question was, classify controlled drugs with examples. Controlled drug classification with examples. So mainly controlled drugs is classified as narcotic drugs, psychotropic drugs, and non-psychotropic drugs. This is the main 3 classification of controlled drugs. Out of this, for the narcotic drugs, there should be a red prescription should be in red color. For the psychotropic drugs, it should be in the green prescription. Whenever the doctor prescribes the medicines which is under psychotropic drugs, it should be on green colored prescription. For the non-psychotropic drugs, white prescription is okay. And the examples for the narcotic drugs: fentanyl, alphenanyl, morphine, codeine, tramadol, like that. For the psychotropic drugs, alprazolam, clonazepam, diazepam. For non-psychotropic drugs, examples are isotretinoin, clobetasol, hydroquinone, MISOPROSTOL, like this. So one important thing is the color of the prescription. For the narcotic drug, red prescription. For psychotropic, green prescription. Non-psychotropic, white prescription. They will ask this thing generally, and also they will ask the examples also. The question number 3, what is the use of misoprostol? Why it is controlled? Why it causes abortion? So misoprostol is used for the protection from the gastric ulcer, for the gastric acidity. Like this, misoprostol is mainly using as a protection from the gastric ulcer. Why it is controlled? Since it causes abortion and also premature labor, That's why it is controlled. It's coming under controlled medicine. We already seen this is controlled non-psychotropic drug, MISOPROSTOL. So what is the reason behind the abortion? MISOPROSTOL binds with myometrial cells of the uterus, and it will cause strong myometrial contraction that will lead to expulsion of the tissue. It will also dilate the cervix, so it will lead to abortion. So that's why it is controlled medicine. Question number 4. What is LYRICA? Is it controlled? LYRICA is the content is pregabalin, and pregabalin is controlled non-psychotropic drug. It's coming under controlled non-psychotropic drug. Which is dispensed against green prescription. Next question was, Viva panel told, choose any prescription and read it and tell the generic name of each. So when you are going to appear this Viva panel, Viva, in front of you there will be almost 8 prescription, 8 or 9 like that prescription will be there. So you had to choose any of the prescription from that. The remaining question will be based on that prescription. So the candidate choose one prescription, that was, it's written Diavan 80 mg OD, Crestor 40 mg OD for 30 days. So they told to tell the generic name of each. So Diavan is valsartan, Crestor is rosuvastatin. Next question was related to the same prescription, how you will dispense it. So Diavan 80 mg once daily and Crestor 40 mg once at night after food. For the Diavan, it's better to take at the morning to control hypertension. If the patient came after with muscle pain, what should you do? What you should do? It's based on the same this one prescription. So we know that this rosuvastatin causes myalgia. That's why it's coming. The muscle pain is coming. So the pharmacist will tell the patient to consult the doctor again. If the patient asks for any analgesic, suppose any NSAID, will you give? No, you cannot give the medicine, any NSAID to this patient until unless doctor prescribe. We have to send the patient to the doctor. What is the patient problem? Patient actually, the Diavan valsartan is using for hypertension, and rosuvastatin is using for hyperlipidemia. Next question. Give me 2 examples of contraindicated drugs in children. Drugs which is contraindicated in children. One is aspirin and another one is tetracycline. Tetracycline will cause permanent discoloration of the teeth. That's why it is controlled, contraindicated during childhood, and aspirin, it causes Reye's syndrome. So both of them is contraindicated during childhood. Next question was, give 3 examples of contraindicated drugs in pregnancy. What are the drugs which is contraindicated during pregnancy? One is MISOPROSTOL, another one tetracycline, another one sulfonylurea, like that. Why sulfonylurea is contraindicated? The panel asked why sulfonylurea is contraindicated during pregnancy. Prolonged hypoglycemia has been reported in children born to the mothers taking sulfonylureas at the time of delivery. So if any pregnant woman is taking sulfonylureas, there will be prolongation of the hypoglycemia. So for that reason, it is contraindicated. The next question, tell me 3 antibiotic classes. and tell their mechanism of action. Antibiotic classification with their mechanism of action. One is beta-lactam antibiotic, example is penicillin. The mechanism of action is cell-wall synthesis inhibition. Next one, quinolones, example ciprofloxacin. Nucleotide inhibition is the mechanism of action. Next class is macrolides, example erythromycin, azithromycin, like that. Mechanism of action, protein synthesis inhibition. So guys, thank you for watching my video, and don't forget to subscribe my channel and also press the bell button. Thank you.